The First Lady, Mrs. Lordina Mahama, says Ghana has made some inroads towards achieving zero new HIV infections, zero discrimination, and zero AIDS-related deaths. To her colleague First Ladies, she said the launch of OAFLA, Ghana chapter campaign for the elimination of mother-to-child transmission of HIV and other programs has pushed forward the government's efforts to achieve the feat. Mrs. Lordina Mahama was speaking at the 13th General Assembly of the Organization of African First Ladies Against HIV/AIDS in Addis Ababa, Ethiopia. A report by Theodora Amedeto.
The First Ladies met at the old building of the African Union Plenary Hall to deliberate on activities being pursued to achieve OAFLA's mandate, basically to provide quality health care for and empower women and children in Africa. The OAFLA chapters in the various member countries updated the Assembly on their achievement, challenges, goals and new projects for the future. Notable among them was the brainchild of the Namibian First Lady, Madame Penehipifo Pohamba, who, with support, developed and handed over a health box to the President of OAFLA, the First Lady of the Republic of Chad, Madame Hinda Debi Itno, for onward distribution to OAFLA member countries. OAFLA President Madame Hinda Debi Itno committed to prioritizing the health and welfare of African women in totality. The First Lady of Ghana, who is also the first Vice President of OAFLA, Mrs. Lordina Mahama, shared Ghana's success story with her colleagues.
It is now clear that the vision of zero new HIV infection lies within our reach, yet its attainment depends upon strong coordination and collaboration within OAFLA, with our governments and our partners. In Ghana, we have recorded over 25% decline in new infections among our youth and 76% decrease in new HIV infections among children over just 3 years. This is due to a gradual strengthening of our health system through the establishment of testing and counseling centers, PMTCT, and effective HIV treatment program, even though treatment coverage is only at 61%.
Mrs. Mahama reminded the First Ladies that collectively it remains their duty to be the voice of the voiceless, use every avenue available to them, and through affirmative action by the African Union Commission, ensure that the global response to HIV and AIDS stays high on the post-2015 development agenda. OAFLA signed a Memorandum of Understanding with the Social Affairs of the AU Commission to work together to achieve the objectives of OAFLA. The Commissioner, Dr. Mustafa Siddiqui Kaloko, bemoaned the negative implications of early marriages on the welfare of girls and the development of countries. He therefore charged the First Ladies to tackle the issue to save the girl child. The 13th General Assembly of the Organization of African First Ladies Against HIV/AIDS, OAFLA, had the theme Zero New HIV Infections Through Access to Health Services for Mothers and Children. Theodora Amedeto, GBC 24, Addis Ababa, Ethiopia.